There's a lot of vaccine news and updates. Dr. Dan tells us what it all means. Welcome to Dr. Dan and Daly. I'm John Daly, and he is Dr. Dan O'Brien, MD and MBA. And Dr. Dan, a flood of vaccine news. First of all, tell us where you are. You're in St. Louis, correct?
Yes, back home in St. Louis, absolutely.
All right, let's go. Let's dive right into it now. First, cases are going up in the U.S., but COVID deaths are down. How do you interpret that?
Great question, John. At first, testing was really kind of meant for healthcare workers and those that are hospitalized. But as testing became more readily available, particularly as far as people walking in drive-throughs, we saw these numbers go up. Secondly, too, is that a diagnostic test became more sensitive. So this was able to really correctly identify which patients were positive. So again, we were seeing more cases. The reason, John, the death rates were going down was the fact that physicians over time, more data was collected and they were able to really refine their treatment options and make sure that maybe not everyone needed to be on a ventilator. So again, as they refine their treatment options, less people actually died.
So based on that, how would you tell people, to look at those findings and the advice for them? What does that tell them?
Right. I really think the advice tells them that we are driving the right side of science as far as what's going on with the diagnostic test, making sure, again, that we're seeing really good long-term data. So I think it's really positive scientifically where we're headed right now.
All right. Next, the FDA has allowed Moderna to get up to 15 doses from one vial. That's up from 11 doses. That seems like good news because there'll be more vaccine doses. But how do you feel about that?
Absolutely, John. This is terrific news just based on the fact that more vials we have, more people are going to get vaccinated. And the goal really is to have everybody vaccinated by the end of May, early June. So this, again, really provides an opportunity for more people to get vaccinated.
Okay, more Moderna news. They can now store the vaccines at room temperature for 24 hours after thawing from that deep freeze. Again, more good news, but do you have any worries about that?
More good news. The big thing here is it has to make sure that this is being properly maintained because it would lose some of its efficacy if it wasn't. So I think it's a good thing, the fact that, again, with that long period of time, we're making sure that the maintenance and everything's being taken care of. But we do have to make sure that we don't want to lessen the efficacy of the vaccine.
All right. He is Dr. Dan O'Brien, MD, and also an MBA. In future segments, we're going to tell you about some more initials coming behind Dan's name. You can check him out at his website. It's drdanmd.com. He's also on LinkedIn at drdanmdmba. All right, Dan, Dr. Fauci says the U.S. might not need the AstraZeneca vaccine in the U.S. here at all, but isn't vaccine demand outstripping supply anyway?
It's a really good question, John, but according to the data, right, we're seeing all these companies that are really jumping in, making sure we have the vaccine. The interesting part, though, about AstraZeneca is the fact that the Oxford University came out with their data showing that there was some issues with the dosing and even some of the side effects, including kind of a rare blood clot disorder that was really kind of being established through AstraZeneca. So this is where the data is so crucial to make sure we've got really good long-term data, particularly around the dosing. So Dr. Fauci is right. I think that we do have to be careful as far as which companies we allow the vaccines to be able to be manufactured.
Okay, so putting it all together, what are your Dr. Dan do's and don'ts for getting yourself ready for the jab of a vaccine? Give us those.
Great question, John. So some of the do's are make sure to inform the vaccine staff if there's any sort of allergic reaction. Definitely do that. Secondly, make sure you're staying hydrated. Very crucial. And the third thing too is if there's any pain or discomfort right after, make sure to kind of maybe move your arm around too, or put kind of maybe a wet cloth on there to kind of help relieve some of the pain.
Okay, and then I hear a lot of questions, and I think we touched on this before. Do you take things like Tylenol or other pain relievers? Should you do it before? Should you do it after? What's your suggestion on that?
You don't want to take any of that prior, no Tylenol, no aspirin, no acetaminophen. You want to make sure to stay away from that as well. And also make sure that you're scheduling your second dose about 3 to 4 weeks after, if that applies to you.
Okay. He is Dr. Dan O'Brien, MD, and also an MBA. As I mentioned before, in future shows, we're going to tell you about some more initials coming behind his name. You can check him out at his website. It's drdanmd.com. He's also on LinkedIn at drdanmdmba. Great stuff, Dan. Thanks for keeping us updated.
Absolutely, John. Always great to see you.
All right, you as well. More coming up, so optimism and confusion over COVID. That's what we'll discuss on today's Dr. Dan and Daly. Hi, everyone. John Daly here, the Daily and Dr. Dan and Daly. He is Dr. Dan O'Brien, medical futurist, who gets me and you lots of answers. Dan, where are you hanging today?
Hey, John, good to hear from you. I am in the Midwest. Here we are in Missouri, also known, John, as you know, as the Show Me State. So here we are.
Okay, well, you're going to show me a lot of stuff. So, Dr. Dan, let me act more like a patient here. I got my second Pfizer shot, and overall, not too bad. 8 hours of being tired and achy, whereas my wife had hardly anything. Is that normal?
Right, great question, John. So according to what we found in the clinical trials, with these vaccines, it really does go through a very extensive pressure test, a lot of scientific rigor, but it does show that symptoms really are quite normal as far as feeling tired or a little bit achy. It really shows that the vaccine is really working.
So you'd agree, feeling sick is actually a good sign, right?
Absolutely. It shows that your immune system is really reacting appropriately to the vaccine.
Okay, so for folks who are, going for that second shot, is there anything they can prepare? Do you have some do's and don'ts of when you're heading to that second jab?
Right. I think the first thing is just make sure, obviously, you're very well kind of equipped with knowledge as far as kind of what to expect. A few things that kind of jump out is make sure with the vaccine, with the second shot, it comes from the same manufacturer as the first shot, right? We've got two different manufacturers. I think that's definitely number one. Also, the second point is make sure that you don't take any pain relievers right before, as that can certainly kind of interfere with the safety and efficacy of that second vaccine. So I think those are two things really to make sure of at this point.
Okay, how about staying hydrated?
Absolutely. I think you make a great point with hydration. Staying hydrated is certainly crucial during that entire period.
Yeah. And don't drink a lot of booze before you go, right?
All right, exactly.
All right. This is Dr. Dan and Daly. I'm John Daly with medical futurist Dr. Dan O'Brien. Check out his website at Dr. Dan MD. That's drdanmd.com. He's also on LinkedIn at drdanmd and MBA. Okay, overall, people are, I would say, growing kind of optimistic and I would say kind of smart. A recent Axios Ipsos poll says 81% of Americans polled will keep wearing masks. 81%. 66% will stay socially distanced, even after they've gotten both shots. So, Dan, here's my question to you. Could these variants that they're talking about, could they blindside us and this optimism here in the United States?
Absolutely, John. Really, with the vaccine, it really protects us for the first 2 weeks. I think that's where the crucial point is the first 2 weeks. But again, as this kind of is going through the beginning stages of, as we're learning more about the data and what it means, that's where we still need to wear masks. We still need to kind of socially distance, because even after that 2 weeks, there still is chances to be able to kind of get COVID after the vaccine. But again, you're usually, for the most part, protected within those first 2 weeks.
Tell me what you think people should picture when they see what we would call an all clear. Is there anything you can kind of point out that you go, aha, okay, now we're ready?
Right. As we see kind of a diminishing of the symptoms. And also number two, John, is the fact that once we can get 75 to 85% of people vaccinated, I think I'm going to feel a lot more comfortable out there as we get more and more people vaccinated. And again, as more data comes out, as we're kind of driving the right side of science, I think that's really crucial. Is the more data that comes out, the more that, hey, okay, this is really working. We know that people are feeling better. The numbers are going down. This way, I think we're able to find out more.
All right. So looking at the numbers, I guess the big question a lot of people are asking me is, do you see us going back to 2019? Are those days gone, or is there a whole different reality, even though we're going to get rid of this?
I'm a very optimistic person, John. So I really think that as we get back, I'm very hopeful, cautiously optimistic, right, that we get back to 2019 as far as kind of where we're at, as people are kind of living the American dream, so to speak, walking around, doing what they want to do. But it really kind of makes us think a little bit about where we're at in terms of healthcare systems and kind of where that's kind of broken down. So I do think there needs to be a lot of work in regards to continuing improving the quality of care as well as the access right now. And I think that, again, I'm cautiously optimistic that we can return to 2019, but I think overall, it's going to make people healthier. I think to look at the positive of this, people are really in tune now with their health on what the future is going to look like in regards to getting them back on the right track.
Yeah, I think you're right. I think it woke up a lot of people to what was unhealthy about what we were doing, not only here in the US, but across the world. One of the things I love about you as a medical futurist, you keep me aware of what might be happening with sports and COVID. So I'm going to ask you this. Will I go back to a packed Fenway Park this year?
Right.
The Red Sox fan.
Right. For all the Red Sox fans, certainly, John, I really think in the future, there will be a point in time where everyone's going to gather. I still think right now we need, according to the literature, according to the data, 75 to 80% of those people walking into the stadiums vaccinated. I think that's really crucial right now to be able to have. But again, as I look to the future, I don't think this year, I don't think in 2021, but as I look to the future years, we will be able to return. You're going to be watching your favorite team there in Fenway Park, watching the home runs, being there with the big monster, with all your favorite fans and probably your favorite beverage. So certainly a great time, in the upcoming years. But right now we have to be just kind of cautious in regards to getting more and more people vaccinated at this point.
Now you're talking. I love that.
Right.
You think at some point to go to like a game, you're going to have to show that you were vaccinated?
Absolutely. You know what, John, you're going to have to potentially have that vaccination card. And also from a public health standpoint, the fact that more hand sanitizers, there has to be more kind of guard as far as beverages and just more kind of awareness around the public health as you're allowing more and more people back in.
All right. Another great report came out this week. This is from the Airlines Reporting Association. Kind of ties into what you were just talking about. It says seniors are booking a ton of flights, but they are not staying at hotels. What are they doing? They're visiting family. I get that. And I think it's fabulous. But are there any uh-ohs there? What's your take on this?
No, sure, John. Someone that loves to travel myself, I really think for the senior citizens, they're really susceptible to a lot of the chronic diseases, high blood pressure, diabetes, and cancer. And I think that it's best at this point to be, again, cautious, maybe not travel kind of around the country or, travel, globally as well. I think it's best to be conservative, to be safe, kind of stay put as we kind of see a diminishing of the numbers, just to kind of look out for family members. And again, just with those that are very susceptible to some of these diseases, you just don't want them to pick up anything.
All right, good advice. We're going to get you when you're traveling pretty soon, and when I'm traveling, and we'll kind of we'll do some remotes here to kind of get this show on the road, so to speak.
All right.
All right, Dr. Dan's house call. Here it is. It's done now. Dan, thanks. We will delve more into the next episode.
Absolutely. Thanks, John. Always a pleasure being on.
Again, he is Dr. Dan O'Brien, MD. Check out his site at drdanmd.com. He's also on LinkedIn at drdanmd. MBA. Yep, that's right. He's got some schooling behind him. And we'll see you for our next appointment on Dr. Dan and Daly. In this segment of Dr. Dan and Daly, Dr. Dan has turned into Dr. Zhivago. Hi, everybody. John Daly here with Dr. Dan O'Brien, and he has become very Omar Sharif-like. Dan, you're looking good. Where are you?
Yeah, hey, John. Great to see you. I'm out here in Keystone, Colorado. Absolutely beautiful. Enjoying the slopes.
All right, so you flew out there with the family, do a little skiing. How comfortable were you getting on a plane?
You know what, John, really comfortable. What we did is we did a lot of our homework as far as the family, right? Making sure that we were following the guidelines, looking up as far as, what those guidelines are with the middle seats with the airlines, wearing the face mask, what to kind of make sure that we're really doing. So we really, I think, felt very prepared as well as very comfortable on the plane. Even though, again, you're not maybe 100% sure, John. Again, traveling, there's no way to kind of eliminate 100% the risk, but you can do some things to eliminate the risk on a plane. For example, make sure you have your hand hygiene. Make sure, John, too, that you're staying in the window seat rather than the aisle seat, again, as that spread of infection is a lot more common in the aisle seat. So I think doing some of these small things really makes a huge difference. And again, our family was really prepared going on the plane.
And I think one of the things I keep hearing, and I think you've said this before, is the fact that sometimes an airplane is actually safer than an airport.
You're absolutely correct, John. An airplane is safer than the airport just because of the traffic. There's so much traffic right now in the airports as people are trying to get to their various destinations. A lot more safer up in the airplane.
All right, so I'm on the plane and someone next to me isn't wearing a mask. What do you do?
You know what, John? You can politely tell them just to put their mask on. Again, that's what the public health officials are doing. Or else, even too, going to a flight attendant, asking them again, could you have some assistance here, helping as far as putting a mask on the person next to you. It's just to keep yourself, your family, those around on the plane safe.
All right. At the ski resort, how was it there? Was it less crowded? Did you see more people kind of staying in their own bungalow? What was going on there?
You know what, John, according to your question, a lot more people are actually staying in their bungalow. They were enjoying time with family and friends. The slopes were not as crowded as all. People were making sure, following the guidelines, wearing their mask, properly socially distancing. But to your question, much more people they're out here, but they're actually staying close. They're staying in their close quarters again, just making sure to be being safe.
And this is Dr. Dan Daly. He is Dr. Dan O'Brien, MD and MBA. You can check him at drdanmd.com and also on LinkedIn at Dr. Dan MD MBA. So Dan, spring break is here. What are your recommendations? Do you let your college kid go on spring break?
You know what, John, my recommendations are right now, according to the data, we need about 80% of the population being vaccinated. So we're not there right now. So I think with my kids, my son or daughter, I would keep them at home. I would look at maybe activities I could do around the house with family and friends. Just the most important thing is just keeping them safe until we have, 80 to 90% vaccination in this country.
How do you talk to your kid when the kid's dying to get out there? Whether it's a guy or a gal, they want to get out there. How do you get to them?
Right, John. I think the first thing, just staying positive, making sure they know what the public health official guidelines are, them keeping them safe. But one thing that I think you could do is, again, spending quality time with them, letting them kind of maybe look into other activities that they can kind of do around the house that they're really kind of passionate about. And again, as this kind of slows down, then I think over the upcoming years, we can let them enjoy their beach or their ski vacation.
All right, you touched on this. A recent survey says about 62% of the people say that if you don't have a vaccine, you can't fly on a plane. If you were working for an airline, what would you tell the airline to do?
You know what, John? If I was working for an airline, I would tell those, people again, you need to be vaccinated. We need to have about 80 to 90% vaccinated before we let people on the plane. Even having a little vaccine card, I think, is really crucial right now. Just because if we see a surge in numbers, we don't have to go back where we were months ago. So it's really important to have that vaccine card to really get vaccinated.
All right. This week, President Biden told the nation that everybody could be vaccinated by May 1st, and we could be celebrating with family on the 4th of July. Is the president a little too optimistic?
No, John, I think the president is spot on. I think the way the numbers are in regards to people getting their vaccines, the numbers are doubling. And I think by the time we get to May 1st, even July 4th, we're going to have a good percent of the population, that 80% being vaccinated. So you're going to be out there enjoying time with your family and friends on the 4th of July.
All right. So you're out there in the cold. I'm here in the warmth inside. I've had both vaccines. I'm still a little bit leery. Am I a wuss or am I being smart?
You know what, John, you're being very smart in regards to, after getting that second vaccine, you need about 2 weeks to make sure that your body, again, is fully recovered and the fact that you're keeping yourself safe from others as well. So given that 2 weeks is really crucial and you're doing the right thing.
Even after the 2 weeks, should I be okay?
You know what, John? Yes. Really stay, again, I think as you kind of socially distance, you may want to still kind of wear a mask and socially distance. But yes, I would confidently say you'd be safe after those 2 weeks.
All right, Dan, I'm going to let you go socially distance back on the slope. So enjoy the skiing.
Absolutely. Thanks, John. Always great to see you.
As always, folks, catch us on our next episode. This is Dr. Dan Daly. He is Dr. Dan O'Brien, MD and MBA. You can also check him out at drdanmd.com and also on LinkedIn at Dr. Dan MD MBA. I'm John Daly. We'll catch you on Dr. Dan's next house call. Dr. Dan weighs in on privacy between you and your doctor. Can you record your doctor's appointments? Hi, everybody, and welcome to Dr. Dan Daly. I'm John Daly. He is Dr. Dan, MD, MBA, and soon an author. So, Dan, tell us where you're at.
Hey, John, great to see you. I'm right here in Nashville, Tennessee.
All right. Well, let's dive into the topic here because there are plenty of recording artists there in Music City, but what if your doctor is against any recordings during his or her performance, let's say? I'm going to dive into an issue here that I encountered. I took my 89-year-old mother-in-law to the doctor's office. The doctor's office had a sign that said, there are absolutely no recordings allowed in the office and during patient sessions. It's curious to me because about a year earlier, I actually took my mother-in-law to the doctor after a serious diagnosis and the potential of a surgery. I recorded the session off my iPhone so I didn't miss anything that my wife would want to hear later about her mom. Now I see that sign forbidding any recording. And if you do record, you cannot be a patient of that doctor. That's what the sign says. So let's dive into this. So Dr. Dan, give me the doctor's perspective. They're more worried about malpractice suits more than anything else there, right?
Yes, absolutely, John. It's certainly a great question. And really, according to the literature, according to the Journal of American Medical Association, it's actually legal to record, even to record secretly. But if you live in California or Florida, you must be able to have consent before you record. And of course, to answer your question in regards to malpractice, absolutely, it's on the top of all physicians' minds in regards to that. So again, the physicians really need to be aware that any conversation that they have with the patient may or may not be recorded. So they have to make sure they're making appropriate statements to the patients, and also that they're taking time to really, watch their tone and how they reflect and how they communicate to the patient.
All right. So check your state laws. That's probably the best thing. Okay. Let's, the perception
Absolutely.
for the patient of the doctor, it kind of seems like the doctors, if they're going to stop you from doing that, is that you're really, you're more concerned about yourself rather than you are about the patient. And then at the same time too, it just seems there's so little time with a doctor anyway. And I got to think that, if you're in there, you're going to start asking the doc to give you as much information as possible in as short a period as time. So what do you think patients should do to make sure that they're going to get all this information, or when they're confronting this, you can't record, dictate?
Right, John. What I think patients should do is they should prepare questions ahead of time if the doctor has certainly any recommendations and any treatment plan. So again, coming prepared with questions is certainly crucial. And also considering asking to maybe record some of the more important information, maybe not necessarily the whole conversation, maybe some of the important aspects, even asking permission first. And again, if a patient decides not to record, maybe even have the physician take notes, hand that off to the patient. So again, you have that transparency between what's really occurring in regards to their healthcare.
All right, this is Dr. Dan Daly. He is Dr. Dan O'Brien, MD, also an MBA. You can check him out at drdanmd.com and also on LinkedIn at Dan O'Brien, MD, MBA. So, so could you maybe create your own written agreement between your doctor and you that allows you to do recording, let's say, and you won't post it on social media, it's just for your information? Is that a good idea?
Absolutely, John. That's a great idea in regards to have that written consent between patient and physician. Again, allowing them to record, but again, maybe making sure not to post that all over social media for it to go viral. So I think that's really crucial as far as running a successful business, having that written agreement. Also, just keeping in mind a customer patient-centric atmosphere too is always really crucial when running a practice. And also too, identifying ways to lower HIPAA risk. This is really important. So that could include, to your point, making sure there's a written agreement between patient and physician at all times.
Okay. Is this something that you think you talk to lawmakers about? Maybe we need to create a blanket law that says they can record stuff.
Absolutely, John. I think they can, just because this is really going to improve the quality of care. And that's what's missing right now in this country in regards to healthcare, is this quality of care. Of course, access to is huge. So if we can improve quality of care and access with these written policies, absolutely, let's go for it.
Okay. Before we wrap it up here, give me your tips of what people should do before a doctor's appointment to make sure that your doctor is more responsive when you only have a few minutes. Give us the Dr. Dan tips.
Absolutely, John. So some of the Dr. Dan tips is make sure to make a list to prioritize before walking in to the physician's office. A list of any questions, a list of any meds is really crucial. And also, John, make sure you bring in a family member or close friend to make sure the communication that the physician is passing along is clear, and there's a friend or family member. Also, make sure you're always honest right there with the physician. The more that you're able to tell your story to the physician, the more he's able to kind of give an appropriate treatment guide for next steps. And also complete any lab work prior to, of course, walking in the physician's office. So he's got all the lab work to make sure he knows where to kind of address the diagnosis and treatment.
All right. Great tips. We appreciate it. Dr. Dan, enjoy Nashville.
Absolutely, John. Always great seeing you.
As well, he is Dr. Dan O'Brien, MD, and also an MBA. We're going to be telling you more about some other initials he'll be getting after his name, and also a new book soon. You can also check him out at drdanmd.com, and he is also on LinkedIn at Dan O'Brien, MD, MBA. Dan, thanks so much. Enjoy Nashville.
Yes, absolutely, John. Always great to see you.
We have another coffee mix for you, and this one is the real deal.
We are using Aretusa rum, made by the 1233 Distillery in Little River, South Carolina.
Now, in other segments, we have profiled Aretusa, which is the name of the Prohibition-era bootlegging ship of Bill McCoy.
His libations were so good, drinkers coined the phrase, the real McCoy.
Now, we thought we'd bring it to coffee, so take a half ounce of Aretusa.
Notice the bottle is almost empty, an indication of how good this rum is.
It's a cross between gold and dark rum.
Next, add caramel macchiato cream. You decide how much cream and sugar you want.
Then brew. You will get a creamy smoothness with a hint of oak from the Aretusa, which is aged in rye whiskey barrels.
So enjoy a little 1920s history with your Morning Joe. This is the easiest chili verde you will ever make.
You can whip it up in a short amount of time for pennies.
Now, if you have leftover pork loin roast, this is the easiest and cheapest way to go.
And it's great for that leftover stage of a pork roast that can sometimes be kind of dry a day or two afterwards.
This dish will keep it moist, juicy, and delicious.
Now, pork loin is cheap, so if you don't have leftovers, simply roast a pork loin in the oven or the slow cooker.
Then slice up the pork into cubes or shred it. It doesn't have to be perfect. In fact, it is better if the pieces are different sizes and shapes.
You'll also want an onion and a few garlic cloves, both roughly chopped.
Plus a 40-ounce jar of green chili sauce. We use the Hatch Valley flame roasted sauce from Costco. It has a medium heat.
But anything you have on hand will work.
Saute the onions and garlic in olive oil for about 7 minutes.
Now, here's the hard part. Add all the pork pieces, then cover with the entire jar of chile verde sauce.
Lower the heat and simmer for about 20 minutes. And you're done.
Serve with rice and or tortillas of your choice.
This chili verde has a nice kick of spice and heat. It's perfect in chilly or warm months.
And remember, you can tone down the heat by using a more mild salsa.
So take care of each other, and we hope we've helped you share some food love with your family.
Stay safe and stay healthy, Jet Setters.